There are many types of mental illness: depression, anxiety, post-traumatic stress disorder, PTSD, bipolar disorder, and more. You may have heard of bipolar disorder before. It is a mental illness that affects your moods. Bipolar disorder is a mental health condition that affects a person's daily interactions, behaviors, mood, thoughts, energy, and ability to focus. Common misconception. A common misconception about bipolar disorder is that a person has frequent mood swings, going from happy or positive to sad, angry, irritated, or other negative emotions almost without warning. But did you know that there are different types? Bipolar 1 disorder, Bipolar 2 disorder, cyclothymic disorder. All three types cause symptoms of either mania or depression or both. Some examples of manic symptoms are unusually high sleep, less need for sleep, talkative, distractibility. Some examples of depressive symptoms are lack of energy, feeling sad, hopeless or empty, lack of emotions or motivation, sleep problem. The difference between each type is when they begin and how severe the manic and depressive symptoms are. It's crucial to remember that each person's experience with bipolar disorder is unique, and that there may be other specific and unspecified bipolar and associated disorders as well. A licensed healthcare expert should make the appropriate diagnosis and treatment recommendations. The first type of bipolar disorder I'll discuss is bipolar disorder 1, which typically begins around the age of 18. Bipolar disorder involves maniac episodes that last at least 7 days, or by manic symptoms so severe that you need immediate hospital care. Depressive episodes are also common. Those often last at least 2 weeks. This type of bipolar disorder can also involve mixed episodes. Bipolar 2 disorders usually starts around the age of 18. Bipolar disorder 2 includes depressive episodes, but instead of full-blown manic episodes, there are episodes of manic hypomania. Mania is a milder form of mania, characterized by episodes of mania that last at least 7 days, or by manic symptoms that are so severe that hospitalization is required. Depressive and hypomanic episodes alternate with mood fluctuations that define it. Hypomania is a milder variation of mania, which is characterized by a time of heightened or irritated mood, increased energy, and frequently impulsive or reckless behavior. Cyclothymic disorder or cyclothymia also involves hypomanic and depressive symptoms, but they are not as intense or as long-lasting as hypomanic or depressive episodes. The symptoms usually last for at least 2 years in adults and for 1 year in children and teenagers. Even though the mood swings in cyclothymic disorder are typically less and less extreme than those in bipolar 1 or 2 disorder, they can still make it difficult for a person to go about their regular activities. Consult a qualified mental health practitioner immediately if you think you or someone you know may be suffering from cyclothymic disorder. A timely diagnosis and the appropriate care can help people with cyclothymic disorder successfully manage their symptoms and lead fulfilling lives. With any of these types, having 4 or more episodes of mania or depression in a year is called rapid cycling. It's important to note that bipolar disorder is a complex condition and each individual's experience can vary. Patients who fall under the categories of group therapy, hypnosis, depression therapy, child therapy, divorce, and invalid therapy should consult with psychotherapy. People with bipolar disorder, a mental health condition characterized by episodes of mania and depression, may also be diagnosed with additional conditions or disorders. The following are some common additional conditions that bipolar disorders patients frequently have diagnosed. Anxiety disorders are a group of mental health conditions typified by excessive and persistent feelings of dread, concern, and anxiety. Eating disorders are mental health illnesses characterized by irregular eating patterns and a skewed perception of both food and body weight. Eating disorders such as anorexia nervosa, bulimia nervosa, and binge eating disorder have been associated with an elevated risk of bipolar illness. Disorders associated with substance abuse, a condition known as substance use disorder, is characterized by the problematic use of drugs or alcohol that causes serious impairment or suffering. Disorders associated with substance abuse, a condition known as substance use disorder, is characterized by the problematic use of drugs or alcohol that causes serious impairment or suffering. A mental health illness called borderline personality disorder (BPD) is characterized by erratic emotions, interpersonal connections, and self-perception. Extreme mood swings, impulsivity, abandonment anxiety, and trouble controlling emotions are common in people with BPD. Some bipolar patients also have concomitant personality disorders, such as borderline or narcissistic personality disorder. Although the precise origin of bipolar disorder is unknown, it is likely a complex interaction of several variables. Several possible causes and risk elements have been identified, including bipolar disorder tends to run in families, according to research indicating that genetics may have an effect on how the problem manifests. If a person has a parent or sibling who have bipolar disorder, they are more likely to get it themselves. Serotonin, dopamine, and norepinephrine abnormalities are among the neurotransmitters thought to contribute to bipolar illness. Additionally, it has been discovered that patients with bipolar disorder have different anatomical and functional brain characteristics from those without the illness. Environmental factors, trauma, stress, drug addiction, and other environmental factors can all contribute to the development of bipolar disease. Additionally, adjustments to their sleep or habits may cause manic or depressed episodes in bipolar patients. Raising awareness of bipolar disease is crucial because it can lessen stigma and give those who are affected easier access to good treatment. Here are a few strategies for raising awareness of bipolar disorder. Gain knowledge. Knowing the symptoms, causes, and treatments of bipolar disorder will help you better comprehend it and help those who are suffering from it. Transmit information. You may spread awareness of bipolar disorder by giving the appropriate information and resource to your family, friends, and community. Ask for help. If you or someone you know is exhibiting bipolar disorder symptoms, encourage them to get in touch with a mental health professional for assistance. Speak up. If it makes you feel comfortable, talk openly and honestly about your experiences with bipolar disorder. This could help to lessen stigma and increase awareness. Raising awareness about bipolar disease can benefit those who are affected and lessen the stigma associated with mental illness.